Introduction. Welcome to the first workshop on artificial intelligence in medical education, healthcare and professional performance at UMSA School of Medicine, where we delve into the fascinating world of the technology and its impact on various fields. Segment 1. ChatGPT Introduction. ChatGPT is an advanced language model by OpenAI, generating human-like responses. It has diverse applications, including medical education and healthcare. Segment 2. ChatGPT in medical education. ChatGPT has potential in medical education. Virtual tutoring. It acts as a personalized tutor, answering questions and explaining complex concepts. Case-based learning. Simulates patient scenarios, helping students practice clinical decision-making. Exam preparation. Generates practice questions and explanations for exam readiness. Segment 3. ChatGPT in healthcare. ChatGPT transforms healthcare. Patient education. Offers accessible and accurate information, empowering individuals to make informed decisions. Decision support. Assists healthcare professionals in diagnosis, treatment recommendations, and extracting insights from medical literature. Mental health support. Provides emotional support and resources for individuals dealing with mental health challenges. Segment 4. Precautions and ethical considerations. We must consider precautions and ethics. Data quality and bias. Ensure diverse and unbiased training data. Accuracy and limitations. Verify information from reliable sources. Privacy and confidentiality. Adhere to strict guidelines to protect patient data. Conclusion. ChatGPT has vast potential in medical education and healthcare. However, responsible usage, considering limitations and ethics, is essential. Balancing technological advancement with responsible implementation is crucial as AI evolves.